Hi, it's Bruce Williams again, and today I'd like to present the seventh and last part of my series on selected gross pathology of the eye, and we're going to talk about neoplasms of the globe and the orbit. As I do at the beginning of all of my lectures, I want to thank my friends and colleagues for providing these images to me either directly or through online collections, which allow me to construct these lectures for you. Here's a wonderful picture by Dr. Fabrizio Grande of a not uncommon neoplasm of the eyelids, and here the conjunctiva of a dog. This is a squamous papilloma, and you can see the small fronds that often characterize these superficial tumors. While papillomas of the conjunctiva can be virally induced, as we also see in the oral cavity and the skin of the dog, the majority of these are just simple squamous papillomas induced by repetitive friction. And if you look at these histologically, the fronds which extend outward from the surface of these tumors tend to be a little more fragile and thin than those we see in viral-induced papillomas, which tend to be thicker and stubbier. Of course, in viral papillomas, you will look for coilocytes, or cells infected with papillomavirus, that are enlarged by a proliferation of intracytoplasmic keratin, giving them a somewhat grayish silver appearance, and often will have small pink intranuclear inclusions. Complete surgical excision of squamous papilloma is curative as long as any predisposing conditions, such as entropion or other forms of chronic irritation, are also controlled. Viral papillomas, on the other hand, often regress on their own. Approximately 70% of eyelid tumors in the dog arise from the Meibomian glands, which are modified sebaceous glands which sit at the junction of the haired skin and the mucosa of the eyelid. They are almost identical to sebaceous glands anywhere else in the body and only get their special name because of their special location. They do commonly form benign tumors. Malignancies of these glands are extremely rare. Histologically, they're classified into Meibomian epithelioma, in which the majority of the cells are poorly differentiated, almost basal epithelium, and Meibomian adenomas, which will range from a predominance of poorly organized sebaceous cells to those which actually very closely resemble normal glands. The biggest problem that we see with these is the predilection of people to want to squeeze them and see if they can get something else, which generally results in extrusion of sebum, not always to the surface, but often into the surrounding eyelid, resulting in a tremendous, profound granulomatous inflammation and the formation of a chalazion, which in humans is called a stye. Now let's talk about a common ocular neoplasm, predominantly of production animals, but we do occasionally see them in the dog and cat, as seen here. And this white nodule arising from the conjunctiva is a squamous cell carcinoma. They only account for about 2% of the eyelid neoplasms in the dog, and they can arise anywhere, especially on the poorly pigmented areas of the eye. Occasionally you'll see them arise in dogs with pigmentary keratitis. As we talked before, you can see squamous metaplasia in chronic lesions, and from these occasionally you will see squamous cell carcinomas arise. There are also rare neoplasms of the eye in cats, but in cats have a higher proportionality of invasiveness extending into the globe. When we look at horses, it is a far more common entity in horses, arising especially in areas with little pigment, higher numbers in lightly pigmented horses as seen here, such as Appaloosas and some Tennessee Walkers. The preferred site for squamous cell carcinoma in the horse is the edge of the third eyelid, as seen here, which is followed by the limbic bulbar conjunctiva, as we saw in the previous picture in the dog. These tumors arise from excessive ultraviolet radiation and are most often seen, obviously, in areas with little protective melanin. About 15 to 20% of these tumors appear to be bilateral in the horse. These are slowly growing neoplasms. They are slow to metastasize, and if they do, it is usually to local nodes. This neoplasm is one of the most common in cattle and has a significant economic impact. Once again, it's most often seen in white-faced breeds as a result of exposure to ultraviolet radiation. As we talked about in other diseases, it's seen in increasing prevalence at higher altitudes. These tumors in the ox and the horse don't arise as fully fleshed out squamous cell carcinoma, and for a period of months to even years prior, go through a series of pre-malignant stages, including epidermal plaques and papillomas. And they may even regress from that stage back to normal. So not all of these will go to a squamous cell carcinoma. About 25 to as many as 50% of these precancerous lesions may regress. In the ox, epidermal plaques are more common than the epidermal papillomas, and both are more common than fully fleshed malignant tumors. When we think about squamous cell carcinoma, we often think about papilloma virus infection. And today, as we start to isolate papilloma virus from a lot of squamous cell carcinomas, there is renewed interest in the possibility of papilloma virus causing these lesions, but this has yet to be established. In the ox, about 70% of ocular squamous cell carcinomas arise on the bulbar conjunctiva, followed by the nictitating membrane or third eyelid, and finally the palpebral conjunctiva. These tumors don't arise on the epithelial line cornea because of the limited mitotic capability of the corneal epithelium. Metastasis occurs once again generally to the parotid lymph nodes, and visceral metastasis of these tumors is quite rare. To give you an idea how common this neoplasm is in cattle, it is second only to lymphoma in overall numbers. When we talk about common tumors in the dog and cat, we absolutely have to discuss melanoma. The majority of pigmented tumors around the eye and orbit are actually benign, and metastasis is rare, but it's all in the location. In the dog and cat, these limbal pigmented tumors are generally benign, so they would be considered to be melanocytomas. But melanomas arising on the conjunctiva are about 80% malignant. There are a lot of histologic classifications and criteria of malignancy for ocular pigmented neoplasms, but the location and where it arises is one of the best indicators of malignancy. So we tend to look at location more than anything else. The most frequent intraocular tumor in the dog is the melanocytoma of the anterior uvea. If we look here, we have a large pigmented tumor that is expanding the uveal tract over the front of the cornea, around over the lens. Here's the optic nerve, which shows us where the back of the eye is. These arise from stromal melanocytes of the iris root or the adjacent ciliary body, and are composed of a mix of lightly pigmented spindle cells and heavily pigmented plump melanomacrophages. The spindle cells are the actual neoplastic and proliferative component, and those plump cells represent mature end-stage melanocytes or macrophages that have picked up melanin. It is often very difficult to get good numbers on the potential for metastasis of melanomas of the eye of dogs and cats because of the long growth period and long latency. But it's thought that perhaps up to 15% of these tumors are malignant, but only 5% metastasize extraocularly, which is still the best way to judge malignancy in these tumors. We tend to assess these tumors for histologic malignancy, and in these cases we predict them with a mitotic index. The benign ones tend to be very high in those plump balloon cells with a very low mitotic rate. Melanoma of the uveal tract is very different in the cat. Most of these neoplasms are classified as diffuse iridoid melanomas. You can see a progressive pigmentation of the normally yellow-colored iris in this animal and another animal where you can see that one eye is markedly affected with pigmentation of the iris while the other looks apparently normal. The tumor, unlike that in the dog, arises from melanocytes on the anterior border of the iris, and over a period of many years progresses to diffusely expand the iris, and almost always ends up with secondary glaucoma. The vast majority of these eyes are removed as a result of complications from glaucoma rather than metastasis to lymph nodes or viscerally. One of the bad actors in the cat's eye is a bulbar melanoma, which has a predilection to spread viscerally, often to the liver. But these iris melanomas will go on for years and years, once again confounding our ability to get good numbers on actual metastasis of these tumors. In the cat, there can be a wider range of different cell types in these tumors than we usually see in the anterior uveal tumors of the dog. The cells in the cat melanomas can look round or spindled, can look like balloon cells, they can be amelanotic or even anaplastic. Here is an interesting disease of Caranterias that seems to straddle the border between melanosis and melanocytoma. It's seen almost exclusively in Caranterias and is often called pigmentary glaucoma. In this disease, which appears to have an autosomal dominant pattern, the irises go from dark brown to black, and you can even see particles of pigment floating free within the aqueous humor. Over time, dark patches become evident in the anterior sclera and the episcleral tumors, as we see here, and eventually these progress to chronic glaucoma and blindness. Histologically, there's a significant increase in the number and size of pigmented cells within the uvea, with both melanocytes and melanophages present in most sections. The condition, if you don't know it's a Caranteria, may be histologically indistinguishable from a diffuse uveomelanocytoma. The causal relationship between the hyperpigmentation of the eye and the development of glaucoma in these cases remains somewhat controversial because you can often see heavy pigmentation in normal globes from certain breeds of dogs, including Scotties and black Labrador retrievers. The second most common ocular tumor in the dog and the fourth most common in the cat is the iridociliary adenoma or iridociliary tumors. There is controversy if these tumors are ever malignant. Dr. Leandro Teixeira at Ocular says that they have seen a few of these tumors that are malignant as judged by infiltration into the adjacent sclera. Metastasis of these tumors have not been seen. And other ocular pathologists simply believe they're all benign and refer to them as iridociliary tumors. These tumors arise from the non-pigmented inner layer of ciliary or iridoepithelium, which often forms well-differentiated papillary or tubular adenomas. The tumor cells resemble mature ciliary epithelium and usually have very little associated stroma. However, they make an abundance of basal lamina, which can be demonstrated by the use of a periodic shift acid. I got that wrong. Periodic acid shift or PAS preparation. I was trying to be so careful with my pronunciation because most people pronounce that incorrectly. It's periodic, not periodic. Okay, well, back to the tumor, and it makes a lot of basal lamina, as all epithelial like to do, but it's especially prominent in these particular tumors. If you want to use immunohistochemistry, these cells stain for vimentin, neuron-specific enolase, and S100, which makes them very unique, especially alongside their epithelial appearance. Whereas you might think that a small tumor sitting behind the iris or at the base of the ciliary root wouldn't cause a lot of problems, and it doesn't from a physical standpoint. These tumors have a tendency to elaborate large amounts of growth factors, especially VEGF, and contribute to the formation of pre-iridal fibrovascular membranes. And the problem with the pre-iridal fibrovascular membrane, or the PIFM, is the fact they tend to expand over the drainage angle, and animals will readily develop glaucoma following development of an iridociliary body tumor. The elaboration of VEGF also causes neovascularization within the eye. And as we said before, newly formed blood vessels are leaky, they tend to bleed, and the production of hyphema will also contribute to the end result of glaucoma. 27% of these tumors are seen in association with asteroid hyalosis, those small globules that are seen in the vitreous following intraocular hemorrhage. Golden retrievers and laboratory retrievers are overrepresented in cases, and one thing that you probably take away from this series of lectures is how many eye problems golden retrievers seem to get. Here's a beautiful transverse section of the eye from Dr. Emma Skirrell from a 12-year-old Labrador retriever, showing a lot of things that we have just talked about, including the iridociliary body tumor right here and the hyphema. So the third most common overall tumor in the eye of the cats is one that we see here in this absolutely gorgeous picture by Dr. Dixon-Vilzig of Ocular, where the eye is filled with a large mass. And this is known as a post-traumatic ocular sarcoma. One thing about cats is if you give them any little bit of inflammation, they're going to try to make a malignancy out of it, whether it's a vaccine or whether it is leakage of lens protein. These particular tumors tend to arise after trauma, where there is mild to massive rupture of the lens capsule and leakage of protein into the surrounding eye, where it sets up an inflammatory reaction. Almost all of the cases in cats have concomitant lens rupture, and this results in a transformation of the epithelium on the posterior side of the lens to a very aggressive mesenchymal phenotype. The clinical progression of disease is described very eloquently by Dr. Brian Wilcock in the 6th edition of Jubb and Kennedy, where he describes how these cats get hit in the eye becomes inflamed, and eventually undergoes phthisis bulbi and shrinks. As these tumors develop, the globe gradually enlarges and becomes spherical again, and the owners are overjoyed about the possibility of a miracle cure. But their hopes are short-lived, because this turns out to be a neoplasm whose metastatic potential may be as high as 60%. Pleomorphic tumors are seen most often resembling fibrosarcomas, but they can range to osteosarcomas, chondrosarcomas, and giant cell tumors. Spindle cell types account for up to 70%. And this tumor has also been recently reported in rabbits as well. This particular specimen, you can see that the lens here, which is somewhat shrunken, has been pushed all the way to the back of the eye by this growing neoplasm. This lovely picture by Dr. Cindy Bell shows a very characteristic neoplasm of the orbit in the dog, which has a conical appearance. They almost always do. And this is an orbital meningioma. These tumors probably arise from cells within the arachnoid layer, which project through the dura mater of the optic nerve and expand into the orbital connective tissue. It's a very unique location for this tumor. Few other tumors will ever pop up here. And the diagnosis is made a little easier by the fact that about 90% of cases have osseous or cartilaginous metaplasia within them. The tumor cells are usually meningothelial in appearance, if you're familiar with meningiomas of the dog. They obviously can cause compression and blindness. They may cross the optic chiasm and travel up the other optic nerve, and they may invade the brain as well. The most common tumor of the eye in cats is lymphoma, which is generally metastatic to the eye. So if you've been keeping track of the intraocular tumors of cats, number 1 would be lymphoma, number 2 would be diffuse iridoid melanoma, number 3 is the post-traumatic ocular sarcoma, and number 4 is the irido-ciliary body tumor. This is a very nice nodular lymphoma. Things that I would also think about histologically, especially in this location, would be an irido-ciliary body tumor because of its location around the iris, although this one is in front of the iris. I would also think about a couple of inflammatory lesions, a cryptococoma in the cat, or a localized fungal granuloma is a possibility. And although this one doesn't look like it, remember when you see huge numbers of lymphocytes within the iris and ciliary body, you should also consider idiopathic nodular uveitis. Here's another picture of a uveal lymphoma. Back of the eye is here. Here is the eyelid, so this is not this is just the cornea cut somewhat oddly. But here's the lymphoma here. The average age of affected cats is about 10 years, and there is no breed predilection for this particular tumor. About half of the uveal lymphomas are seen in association with the lymphoplasmacytic uveitis I just mentioned. However, there's no clear relationship between the two conditions. The anterior uvea, probably because of its vascular bed, is the most commonly involved tissue in the cat's eye. Cats are not the only species to develop ocular lymphoma. Here's a ferret, and the eye is being pushed forward by an orbital lymphoma. In ferrets and other species, including cattle, these tumors tend to prefer tissues of the orbit. In cattle, it's usually the retrobulbar fat pad, so as the tumor grows, it pushes the eye outward. This is similar to what we see with spinal lymphoma in cattle, which does not arise in the spinal cord or the meninges, but usually arises in the fat that is normally present within the vertebral canal. In the cow, when you see this lesion, the vast majority of these particular animals are infected with bovine leukemia virus. One more manifestation of lymphoma in the eye in the chicken is what is seen with Merrick's disease, in which ocular lymphoma also affects the iris, and the massive infiltration of lymphocytes results in a condition which is characterized by a narrowing of the pupil and a diffuse white coloration to the iris because of the infiltration of large numbers of cells. And this has been referred to as gray eye in chickens, but is one of the many manifestations of Merrick's disease, or infection by avian herpes virus 2. Well, we come to the end of our series on ocular pathology, or at least gross ocular pathology. I hope you've enjoyed these lectures. Once again, I want to thank everybody that's provided images over the years, and I want to thank you for your attention, and I hope you've enjoyed this, and you look for the videos covering the gross pathology of other systems and other species on the Davis-Thompson Foundation Facebook page and YouTube channel. Have a great day.